Hey you guys, welcome to another round of your live Q&A here in our Fit for Life Facebook wellness group. And today's question that I have to answer for you is, what can I do for my nagging knee pain? This is a good question. So it's actually kind of funny, and I want to preface it by saying, it is really difficult to make generalizations with regards to pain in general. Good morning, Jenna. Hopefully we have a few people that are going to log on this morning. I think Leonard said he was going to try to hop on too. So if you guys happen to catch this live, make sure you say hi in the comments below. And if you have specific questions, feel free to post them. My hope is that this can be an interactive type of a situation. So nagging knee pain. This is the preface that I want to make with this is, some kind of funny that happens when you become a PT. On more than one occasion in my life, I will get these messages from friends or family that's something like this, like, "Hey Jenny, my elbow hurts. What can I do for my elbow?" Or, "My knee hurts. What can I do for my knee?" And it's kind of humorous, sitting on this side, because we don't have like a recipe book, basically, is what I want to say. There's not like a recipe book of exercises that we can open up, when somebody has, pain in a certain area. So it's very difficult to make generalizations for pain and for what you can do. But there are a few things that I thought I could share with you. First of all, when you're talking about knee pain, there are several different things that could be going on, right? There are several different causes of knee pain, and this is why the generalizations are sometimes difficult. So one of the things that could happen is you could be experiencing regular old wear and tear, osteoarthritis, or degenerative joint disease that can contribute to some pain in the knee. You could have an issue with your meniscus, which is the shock-absorbing little pillow or cushion in the center of the knee, one on the inside, one on the outside. That could be giving you some trouble. You could be having some trouble with your kneecap and how it's tracking in the groove where it's supposed to sit. You could be having trouble with the tendon, the patellar tendon, which comes around that kneecap and inserts below the knee. So it depends on the problem. The solution depends on the problem, and your specific exercises that you're going to need depend on what the source of the pain is. So your specific treatment will be unique to your problem. And so that's why, if you are experiencing pain in your knee, it would behoove you to get it checked out by somebody who can put their finger on it and try to help you determine what's going on. That being said, I do have two things that I wanted to talk about in terms of a generalization that, almost regardless of what is the cause of your knee pain, there's two things that you want to do. Number one is fix your feet, and number two is strengthen your hips. And maybe that surprises you, because I didn't really say anything about the knee in terms of exercise. Now, it's not to say that you won't be exercising that knee, but the knee is a pretty simple joint, right? It literally bends and straightens just like a finger joint. It's pretty stable in and of itself. The problem is it sits between two pretty unstable joints, the ankle and the hip, and the leg is a long lever arm. So there's a lot of forces that can go through that knee. So the first tip is fix your feet. And what I mean by that is understand what your foot type is like. Again, helpful to know or to have somebody check it out, either someone at your local running store or a physical therapist, somebody that can look at your foot and say, do you have a high arch or do you have a flat foot? Either way, it's going to make a difference in the type of shoe that you wear, the type of footwear that you choose to wear. And if you have a high arch, you're going to want shock absorbing cushion type shoes. And if you have a low arch, First of all, you're going to want to strengthen your feet. You're going to want to fix your feet like we've talked about before, doing some toe yoga and some arch building exercises. And you're going to want to make sure that you have supportive arch, corrective type footwear to support that arch, which actually then improves the alignment and position of your knee. So that's tip number one, is understand your foot type and what you need to do to make sure that when your foot contacts the ground, you have good mechanics all the way up that chain. And then number two tip is to strengthen your hips. And this is almost irregardless of what the cause of your knee problem is, you're going to need to strengthen your hips. So even, for patients who are looking at total knee replacement, they're going to be going in to fix that degenerative, osteoarthritic knee. Most of the exercises that surround the knee rehab involve strengthening the hip. If you have arthritis, if you have a meniscus, if you have a patellar injury, if you can strengthen your hip, it will tighten up the mechanics of that knee joint and help with pain. So strengthen your hips, and that will help the knee. And then if you have any of those other things, like an issue with your patellar tendon, runner's knee kind of things, there's going to be very specific exercises for that. So those are my two general tips for what can you do about nagging knee pain: fix your feet and strengthen your hips. I have some free resources for you if you are interested. The first one is the Fix Your Feet PDF, and that is available inside this group if you're watching this inside the Fit for Life Facebook group. If you're interested and you don't have that PDF, simply comment flat feet below this video and we will get that to you. That's a series of, I think, 10 exercises that I've put together that can help you work on strengthening your feet muscles. There are some hip exercises in there too. Spoiler alert. And then the second resource that I wanted to share with you is I have a blog post that I wrote a bit ago, and it's called Firing Up Your Glutes. And that has some very good hip exercises, hip strengthening exercises as well. So I will share both of those resources inside this group below this post. If you're watching this on social media sometime later, you can comment below for the PDF, and I will put that there for your flat feet, and I'll post a link to the blog post as well for easy finding it. What I would suggest is that if you are experiencing nagging knee pain, that you give these tips a try, and if they're still not helping, if it's not enough, that you come on in and let us take a look at your specific problem. At Fit for Life here in Concord, I offer a 20-minute session. It's called a discovery session or a total body diagnostic. And in that 20 minutes, I can literally put you through a very brief posture and movement assessment to really put my finger on what do I think the cause of that knee pain is. And then we can really fine tune what it is that you should be doing to get back to doing the things that you love to do, right? To live that active lifestyle. So if you're in that situation and you're ready to take action and let us try to help you with that knee pain, I'll put the link for our Ask About Availability form in the comments below this video too. Thank you guys so much for watching. I hope everybody enjoys the rest of your day. Until next time, when we answer your nagging questions and help you to be fit for life. Thanks, you guys. Have a great one.